It is a pleasure to follow Luann because we have an old girl network kind of story. When Julie and I were coached to write this book, we weren't really sure if we wanted to write a book. Could we write a book? We were both had young kids. And so Julie had Luann as a mentor when she was in training. And so Julie emailed her and reached out, can we meet you for lunch? And of course, we met for lunch at UCSF at Paleo, and Luann said to us, yeah, can you use the mic? Oh, I can use the mic, yes. I'm wearing a mic.
Yeah, you can use either.
Yeah, okay. And so Luann met with us and really encouraged us to go ahead and write The New Puberty. So it's a real pleasure to be following you because I think it is a sign of how we can all support each other. And so I don't know if I should call it the Old Girl Network or if I should.
Is that me?
And this has been intentional. You've seen the mentor and mentee duad yesterday with Christine Dellendorf and following Jody Steinauer.
Okay, good, that one's off. Okay.
This one's off.
She said this was intentional because of the mentor program and the people who spoke yesterday.
Yeah, Christine Dellendorf that followed Jody Steinauer, and these guys are following Dr. Brizendine.
So we do want to say that we're going to leave time at the
Can you take this away?
Okay, we're going to have to stay away from each other.
Okay.
We do want to tell you that we're going to leave time for questions at the end because Julie and I really love taking questions. We'll also be signing books for individual questions, but we do find that people bring up the most wonderful things when we give this talk. So, and it's a real great pleasure to be here sharing this information with you. We do want to tell you that we do have a disclosure. Okay. We actually, it says no disclosures on this book, but technically we wrote a book, and that counts as a disclosure. I can promise you, though, writing a book when you're about puberty may not be the best way to put your kids through college. There's not very much disclosure. We are talking about this. I think all of you have heard or had patients or family members probably talk about puberty and when it started. There's been a lot of media attention.
Louise, hold on. How many people can't hear Dr. Greenspan?
I think you need to turn off the microphone that's on the table.
That one's off, but the question is
can you hear me? Me and my loud ex-coxswain voice.
That's why you're going to speak.
No, you have it over on the side.
I can microphone lower.
I don't know. I'm good at this. Okay.
This is off.
Okay. So there's been a lot of media attention and a lot of sensationalization, and I think that's partly conflating puberty and sexuality, and people start thinking that girls going through puberty means a lot more. And Julie and I really wanted to set out to dispel some of the myths, especially the lay media. And we had been trained as part of our research by the Stony Brook Center for Communicating Science. And the one quote that really stuck with me, and also was instrumental besides meeting with Luann, for Julie and I to write this book, was we don't talk about our research, someone else will talk about our research and won't get it right. And I can tell you, for all the people who do research in this audience, you know your research better than anybody. And if you don't get out there and feel comfortable talking to the media or doing some lay discussions, somebody else will, and they might not get it right. And that's why Julie and I both ended up being in the media a lot, because we felt like we wanted to do this. I also think we were the two young women. We were in a study with like 20 investigators, but there were only 3 women kind of in our age, and one of them in New York has also been in the media, and I think people wanted us, and I think actually being mothers and being women helped us. And I know on a couple prominent TV shows when I was on, I asked them, why are you asking me? I'm not a PI, there's 3 PIs, there's 3 co-PIs, I'm just a co-I. And they said, because you're a woman, you're an endocrinologist, and you have kids. So I really want to talk, to emphasize that our being who you are can really be helpful sometimes. So I want to make sure that we lay down the groundwork of what puberty is. A lot of you probably remember this from medical school, but I just want to make sure for those of you who aren't pediatricians that we make sure we define terms appropriately. So puberty is not menstruation, and when most people in the lay audience hear about puberty starting earlier, they leap to first periods. Puberty does not start with your first period. Puberty usually starts with thelarchy, or the onset of breast development, or breast budding. And pubarchy tends to happen second. That's the onset of pubic hair development. For some girls, there's a pubarchy pathway where pubarchy can start earlier. And that's a really interesting subject about which pathway you're on, because they probably predispose you to different health risks when you're older, but that's out of the scope of this discussion. Puberty is not a single event. It's a series of changes that takes place over 2 to 3 years, or 2 to 4 years. And the timing and the tempo and the sequences of these events vary. Some of the changes are visible, but some are not. So for example, the changes that might be going on in the kids' brains are not visible. And I joke, sometimes I think the first sign of puberty is not thelarchy, but it's slamming doors. And the emotional changes that happens as the kids' brains are developing, Julie's going to talk about. So when I was in training, a long time ago, I graduated medical school in '95, so I'm old now. I was told, and even in my pediatrics training, I was told that any pubertal development prior to age 8 was abnormal, and that menses prior to age 10 was abnormal, and to put boys into context, 9 was being used as a cutoff. And then in 1997, Marcia Herman Giddens was the first author on a paper that came out in '97 in pediatrics, which was a cross-sectional analysis of thousands and thousands of children across the country in the pediatric research in the office setting. And they found that puberty was starting a lot earlier. Pediatric endocrinologists did not accept this. I think partly, Marcia and I have talked about it, she's a lovely woman, another mentor to Julie and me, and we interviewed her for the book. And Marcia says she thinks because she was a PA and a PhD, not an MD, and because she was a woman, and most of the pediatric endocrinologists prior to the 90s were men, and I think they looked at her with a little bit of skepticism because she was not an endocrinologist. But there were some that really felt that this research was groundbreaking. And so in 2002, we were funded by the NIH to be part of a large multi-center grant to get into this in a longitudinal manner. And so the groundbreaking work that Julie and I were a part of showed some pretty amazing things, results. And for our local site, for the group as a whole, this paper came out in 2010, and we showed that at age 7, 10% of Caucasian girls, 25% of black girls, 15% of Hispanic girls, and 2% of Asian girls had signs of breast development. And this was really groundbreaking when we had thought prior to this that age 8 was the cutoff of normal. When you have 25% of a subset of a population with something, you know that you have to change what you're considering to be normal. And this was a study of 1,200 girls in New York, Ohio, and San Francisco, and we studied them from age 6 to 8 for 10 years. So the study just ended a couple years ago. They were a racially, ethnically diverse group, and we included Asian Americans, and that's very unusual. There's studies of Asian girls' puberty in Asia, specifically China and other parts of Asia, but this was the first study that was longitudinal of all girls, and it was the first study to include a significant number of Asian American girls. We really want to make sure that when I speak to the lay audience, we talk about these the differences in ethnicity in the groups by ethnicity are not genetic. We think they may reflect other environmental or socioeconomic differences. And when we did look at over time, you can see that at age 6, 2% of girls had breast development, 9% by age 7, and then it goes up as we talked about. So when we look at the ethnic differences, you can see in blue is the black girls, and in orange is the Hispanic girls, and you can see pretty much the whole way along, they are having a higher rate of breast development at earlier ages. The Caucasian girls are in green, and the Caucasian girls are in purple, the Asian girls are in white, and there's probably not a statistically significant difference between the two of them. So by the time the girls had all had breast development in 2013, we were able to publish the average ages of breast development. Remember the context that we used to say 8 was the cutoff of normal, as in 2.5%, we're not starting, 2.5 standard deviations. We found that in African American girls, 8.8 years was the average age of thelarchy. For Hispanic girls, it was 9.3 years, and for Asian and white girls, it was 9.7 years. So this is corroborating what Herman Giddens' paper said in '97. So I think this is now widely accepted and has been really instrumental in changing how we evaluate girls for early puberty. Pubic hair development was similar. The girls are going through a lot earlier, and the African American and Hispanic girls were starting earlier. Our menarche data is currently being analyzed. It's really close to submission, as in we literally might be submitting the paper next week, but we're just tidying up the data, so I can't tell you what that is yet. But I can tell you that it doesn't look like menarche is starting earlier, and the NHANES data supports there is a difference between the 3 major ethnic groups that have been studied, but there isn't a significant difference, and we do not think that puberty is starting
Menarche.
right?
Menarche.
Menarche.
Sorry.
Menarche is starting earlier. Thank you, Julie. Julie's going to step in for a couple minutes. And
Okay.
I'll step out for her.